call this meeting. I'll go ahead and call this meeting to order. This is our quarterly membership meeting for U.N.I.T.E, Uniting Nursing Homes and Tribal Excellence. We'll go ahead and take attendance to start with. So I've got Deb and Tammy. I have, is Brandon and Jamie and Christina, right, from KAI? Did all three of you stay on?
Yes.
Yes, that's correct.
Okay. Jamie, okay. And then I have Dr. Brune. And is Jared on still?
Yes, this is Jared.
Okay, great. And then let's see, who else? Who else? did we
Yasmin is
lose?
still here. I'm here from
I got,
Legal
oh, good.
Aid.
Yasmin's still here, and then Brandy. Am I missing anyone? Let's see.
There should be 12 participants.
Yeah, I see that. 11, I'm missing someone. Brandy.
Looks like there's
I
Brandon,
have
Christy,
11.
Jamie, Ron, Debbie, and then Dr. Brune, Melissa, Tammy.
Oh, Melissa's on. Okay, Melissa Martinez.
Melissa Martinez. Yeah.
Okay. Is that Melissa from KAI?
No, ma'am. I'm Melissa. I'm the executive director for Laguna Rainbow Corporation. I spoke to Ron. I'm going to be joining the 2022 year membership, and I asked him if I could join in the meeting today since I'm going to be joining.
Oh, that's excellent, Melissa. We're so happy to have you.
Thank you. Yeah, I'm out here in New Mexico,
Yeah.
the Pueblo of Laguna.
Do you know if Joseph was going to try to be on the call today?
I don't know. I haven't talked to him for a couple weeks.
Okay.
Joseph emailed us to say he's on another call with the White House
Yes.
Disability Services.
All right. Well, we'll let him do that.
He said he'll try to join us if he can.
Okay. All right. Well, I'm going to share my screen and go to the financials, and we need to approve October's. Did everyone get a chance to look at October's? Because we had them up last month, but then I don't know why we didn't actually vote to approve them. Did everyone get a chance to look at them?
October will be part of November's.
Oh, okay. So we need to vote today to approve both October's and November's. Okay. So let me share my screen. Okay, so this is the profit and loss statement.
Correct.
All right, so Ron, do you want to just kind of remind us what this is?
Oh, sure. Our revenue through October, the first 10 months was 4,300, and our total expenses were $5,102. So through October, we had a loss of $802. Do you have November's available?
Yeah, let's see. I thought that's what this was. Let me go back. The one, I'm looking at the one you just sent. Let's see.
Should be December.
Yeah, I was looking when you just sent it today, right?
Correct.
And I saved it here. Let's see why it's not showing up. 12 p.m. That's probably it. November, yeah, here it is, 2021. That's
Okay.
profit and loss. Okay, go ahead.
So through November, you can see that most of the income came in through membership at the beginning of the year. And then in July, the Tohono O'odham Nation down in Arizona joined. And so through November, it's 4,300. Our expenses were 5,369. So For the year, we had a loss of about $1,070 or $80. And that's because we got that grant from the National Congress of American Indians back in the fall of 2020. And so those expenses were paid in 2021. As you just heard, Melissa Martinez is with the Laguna Rainbow Nursing Home in New Mexico. And Melissa is where Joseph Ray is on the board, and they will be joining as a facility member. And so we'll be able to increase either, that'll show up in December or January, either one, it won't matter. Going into the balance sheet then.
If I can find it.
Okay, it should be right next to the, there it is, up there at the top, very top. Oh, back down now a little bit.
Sorry, I don't know why these jump all over when you save them.
All right, you're right in the middle of that page, right there.
Yep, there it is.
Okay. So cash in the bank at the end of November was $6,552. We had retained earnings through 2020 of 76.22. And so through November of 21, we had that loss of $1,069, which correlates to the penny to the profit and loss statement. So our equity position is the same as our asset position. So we have just a little over $6,500 in the bank with no liabilities at this time. And so that would be the October and November financials.
Okay, excellent. So may I please, those that are members, we need to vote on approval for the October and November balance and profit and loss sheets. May I have?
I move to accept both October and November financials.
And this is Jared. I second that.
All right, all in favor, say aye.
Aye.
You'll have to unmute if you're gonna do this. Say aye.
I
Okay, is there anyone opposed to not approving these financials as presented by Ron today? Anyone opposed? Okay, then they're accepted. So thank you, Ron, for keeping up with all that too. I'd like to give our guest, Melissa, a chance to kind of introduce yourself, tell us, a little bit about yourself and what's happening out at Laguna Rainbow. We'd like to get an update. That'd be great.
Hello, so my name is Melissa Martinez. I'm an executive director here at Laguna Rainbow. We actually have a nursing facility, 58-bed, and we also have a senior center that we run. And so that makes up our whole entity out here in Laguna. We're probably about 40-ish, 45 minutes west of Albuquerque. Along I-40, and we currently right now we've been working actually quite a bit with Ron because we're trying to get an EMR in place for us out here. We've been going through the same struggles, I'm sure, as everybody else with the COVID pandemic. And then now this year, the staffing crisis, but we've been faring pretty well, honestly, with the staffing, with local staff, for especially like our frontline staff. Minus nurses, we only have a few local. But other than that, I've been in the industry 22 years. I'm also a registered nurse, and I love what I do. And I've been part of this community in some capacity for the last little more than 3 years. I was a director of nursing here. I also served as a board member, a treasurer for the corporation. And so that's me in a nutshell.
Are you native to New Mexico?
I am native New Mexican. I actually was born probably like 15, 20 minutes from here west in Grants, but I grew up in Albuquerque.
Okay.
And so
Are you a
ironically,
tribal member?
I am not. Ironically, my mom grew up in Grants and she used to take the bus to the mission school where a lot of people from Acoma or Laguna went. So it's funny because she's known some people that I've worked with because she went to school with them way back in the days. And so I just kind of feel connected to this area.
Very good. Well, we're delighted that you're going to join U.N.I.T.E and be part of, what we've been at for since 2014. So thank you for joining. What's your census like right now? I mean, how many bids are you admitting?
We are admitting, we're only at 39 right now. We're struggling with census and recovery. A lot of that has to do with the really strict restrictions that we work with. Our tribe, our emergency response, they're called EOC. And even before CMS mandated vaccinations, we mandated vaccinations in March. We actually only lost one nurse to that though. Other than that, it only affects us here and there with some agency because we don't allow any exemptions, medical or religious. And then they only allow residents that are vaccinated to be admitted. And so we sometimes have to, unless it's approved by them and it's really like an emergency kind of social service type situation, but all of our residents actually are vaccinated and everyone that can has received the booster as well. And so restrictions, we still aren't being allowed. I'm trying to work with them right now to get the visitations lifted for indoor visits. We've been trying to work with them for months for that, but they've been really strict on it. So we hopefully are coming to an agreement to be able to start having some of those visitations allowed besides compassion care visits.
Have you had any cases of COVID, people testing positive? Can she hear me? I was just curious with all the restrictions, if you've had any cases of COVID.
They had an outbreak October. It started right at the end of October 2020. And then there was a few residents here and there this year, just like a random one here and there, I think maybe 3 or 4. And then we've had a few staff members here and there, but knock on wood, we haven't had a resident. It was before I started as the ED in the end of July.
Okay.
There we have to sometimes work out. One of the first things I did when I was out here was write up a guidance for return to work because if their household is exposed, they lock down the whole household. And so we've been able to get healthcare exemptions now because they were locking, like if if somebody in the classroom was exposed of a child, then the whole classroom and that child's family, they all got put in to quarantine. And so we had to navigate some of that because it was affecting our staffing because they were getting thrown in isolation for being a contact of a contact. And so we've worked through that and we just have them on speed dial now and we get the healthcare exemptions.
Just you worked with the state of New Mexico, so you'd
No,
actually have
EOC.
staff.
Yeah, no, it's EOC, it's our tribe EOC.
Oh.
We haven't had to do crisis staffing since they had their outbreak in October. They had a couple, I think like a nurse come in that was contracted through the state, but they're not really doing that anymore. I mean, everywhere is in such a crisis. There's no staff. I mean, the Navy's helping with one of the hospitals up in Farmington area right now because they enacted the crisis mode up there. And the hospitals are so overwhelmed out here that they've approved like 5 nursing homes in Albuquerque to run below a 2.5 PPD because they weren't taking admissions because of staffing, but they gave them a waiver so they can push admissions out of the hospital because they're so overwhelmed. We have to report our bed capacity every day to the state, but I always, like, they haven't pushed on us at all, but I would just get them in contact with the tribe because the tribe's not going to allow that for them to just push those admissions.
So there's people in the hospitals in Albuquerque that they're sending out to the nursing homes?
Yeah, it's statewide really. We're just close to Albuquerque and I have several former colleagues that I still talk to daily and they just kind of keep me up to date what's going on around the community. And then on our DOH, our Department of Health calls with New Mexico, they give some of the updates. Like apparently there's a transportation crisis in New Mexico now too. So they've been transporting patients out of the hospital to the nursing homes in private cars. And there was some nursing homes refusing the admission because it wasn't a medical transport. So they enacted a guidance basically saying that nursing homes weren't allowed to turn away those transportations. And then they're also tracking any facility that sends a resident to the ER, they're tracking it. And they mandated like the interact forms. And if they start finding issues, then they'll start fining them. So they're really pushing back on keeping people really out of the hospital. But that's some of the stuff that they've, even just in the last couple of weeks, started implementing for the state.
As hard as a nursing home to send someone back to the hospital is what you're saying.
Yeah, so the nursing homes, they're really pushing against sending anybody to the hospital. So that's what they're doing. They're tracking it.
Wow.
Yeah.
Tammy, have you or Deb seen that in where you are?
Have we what?
Have you seen that, Tammy or Deb Arbogast, where you are, that what she's talking about?
No, we haven't experienced that at all.
We haven't experienced that at all either.
Okay, good. Does anyone want to ask Melissa any questions or have any comments? We really appreciate your joining our call today, Melissa. We're glad that you're going to be joining U.N.I.T.E. I'm going to go ahead and let Yasmin kind of update us on leading age, and then KAI, why don't you guys give your report again when she's done for the membership meeting? Go ahead.
I just wanted to report 2 things. One, we have our National Leadership Summit in March. There'll be more information to share in the next couple of weeks. I believe the registration opens in January, and it is a much smaller meeting than our annual meeting. We have typically had C-suite members attend that meeting, but we're expanding it, and I'm trying to open it up more so that not only the sessions and the topics resonate with more of our members in various levels, but also so that we can make sure that people have opportunity to attend and feel that they're getting value from the meeting, again, at different levels and not just the C-suite. So that meeting's at the end of March. Again, I'll follow up with you about opportunities to either host a session or maybe have some of you come to the meeting, but I would love to see that. I'd like to share more of what the content will look like so that I can see if you see value in being part of that meeting, and then moving forward from that on invitations. The other thing is Debbie's been working with our national office to update the MOU that Leading Age and U.N.I.T.E has together, which is really a body of work where we're agreeing on how we will operate together, and U.N.I.T E maintaining its own entity, its own name and mission, but also being able to draw from resources of Leading Age and share with Leading Age members. So we have been in conversations about updating that and making sure that all of that's in sync going forward. And so far it looks good. I know one of the commitments that Diane and I have, Diane is my supervisor. She's the Senior Vice President of Membership, and I am the Vice President of Member Engagement. We are very interested in identifying some priorities in that agreement where we can work more closely together to support membership recruitment and building more awareness of U.N.I.T.E in the coming year. So those are two things that we're looking at specifically, but we'll be talking more with the executive team and of course Debbie to really finalize what we see as real opportunities for working closer together in the coming year. And that is my update.
All right, thank you, Yasmin. And just so you guys know, when we had that call on December 1st, some of you were on that call to talk about, you know, our value statement and how we can add more members. I agreed, and Jared sent me a list of our current members or who's joined in the last year. And so I have that. So Jared, thank you for sending that. And my goal is just to call. We decided just to kind of do an informal survey. Like if you remember when Julie Cahoon with KAI used to just, you know, like if we had a best practice report, we'd put together some questions and then she would call different tribal nursing homes and get that information. Because sometimes when you're just talking on the phone with someone one-on-one, you get more. And so the thought was, if I, as the president, called and just said, hey, you know, we know you're a member, we just wondered, you know, what would make you want to re-sign up, or what made you join in the first place? What's the value of U.N.I.T.E? And kind of use that information. Like it's kind of an informal survey. So we are in the process of doing that. And I do have just something I typed up that I'm going to share with you. And then if you guys want to add to that on our value statement, I just kind of got something started. It's just a draft, but at least something. I wanted to get something down on paper, you know, get it out of my head and down on paper. So I'll show you that here in just a minute. So Christina, you want to give us an update again on KAI for our membership meeting?
Sure. So folks should have received the December issue of the U.N.I.T.E newsletter this past Tuesday, the 14th. Content for the January issue of the newsletter is the last Wednesday of this month, so December 29th. Please submit content if you can. We will be sending out the December issue of the LTSS newsletter early next week. And we had an LTSS webinar yesterday on traditional foods, and our next webinar will be on January 26th. Stay tuned for more information about the presenter and the topic. Thank you.
All right.
Debbie, you're away from the microphone, so if you're talking,
Yeah.
we can't hear you.
January 26th is the next webinar. And I would suggest, if you are like Deb or Tammy or anyone at a facility, like Christmas pictures are always good, right? We're in the Christmas season. So if you've had special things going on at your facilities, those would make excellent pictures to send to me. And then I'll send them to KAI. Those would be good for our January newsletter, kind of looking back, how we got through the holidays, that type of thing, I think would be really good. Okay, thank you very much, Christina. I'm gonna share the value statement. Let's see here. Let me go back to the share screen. And I just want to get your thoughts. So I had to think about just what we talked about and some stuff from our annual meeting. And I know one of the things that came up a lot was this idea of collaboration. So I put U.N.I.T.E's value as an organization mainly is in its collaboration between tribal members, tribal nursing homes, and tribes across the United States. Times are changing rapidly, and it is imperative that tribal nursing homes stay connected with what is happening in individual states and communities in order to establish best practices and excellent care for our elders. Our elders deserve no less. Changes occur when people meet to honestly address the issues of the day. It is these relationships that drive change and make for a better life for our elders. Please join, participate, and share your stories. Together, we will make a difference. So that just kind of came off the top of my head. Anyone have any thoughts or just, I mean, again, this is just a really rough draft. I just want to see what you guys initial thoughts or something that comes off the top of your head. I'll add it in.
I think it sounds good. I like it.
Okay.
I like it a lot, Deb. It was effective.
Well, so something, Ron, that I was thinking about after our talk on the first is like kind of speaking from our hearts, like not getting too, like we're writing a formal paper, but just really speaking from our hearts and trying to keep in mind, who we're actually doing this for. Like, we're not just having meetings to have meetings. We're supposed to be having meetings to make, to find out what's going on. And I mean, good things should come out of these meetings, whether it's ideas for staffing or whether it's advocacy positions we want to take. I mean, something should come out of these meetings. We're not just meeting to type up some minutes and, whatever. We're trying to increase our membership. We're, partnering with Leading Age, hopefully for a reason. I mean, that should add value to U.N.I.T.E's membership. I'll probably add something in here about partnership with Leading Age. I'll just kind of make a note. What else? Anything else you can think of? Maybe our website, our newsletter. I'll put that in here. Best practices. Maybe some historical context, the work we've done with other tribal organizations. Anything else? Okay. So we don't officially I'm going to stop sharing. We don't officially have a speaker today, but for those of you like Melissa who weren't on our board call, Dr. Brune, do you want to just give us another update? Just kind of reintroduce yourself and your work.
Sure. Dr. Kendall Bernay with Meharry Medical College, and I'm also an owner-operator. That's okay. My name, that's why they call me Dr. B, because it's only, 2 vowels and 3 consonants, but it gets messed up so much.
I'm sorry, I'm very phonetical. I apologize again.
No, that's okay. But I'm in family medicine, and especially as and a licensed nursing home administrator. But specialization is that I am Chickasaw, so I'm working with American Indian aging issues, and specifically with the Medical Directors Association on how they increase awareness and exposure to the tribes so that we can gain in native ways of knowing and learning. And was introduced to this group by Dr. Judy Goforth Parker and Ron Ross through Nebraska, a mutual friend in Nebraska. And so hope to continue to add value from what's going on from a medical director's position, and also from a long-term care perspective. I was on the research team with the program with Bill Thomas with the Eden Alternative. Actually was part of the group that wrote his first book, The Eden Alternative, in 1990, through a project Life out of the University of Missouri, Columbia. I was at the Center for Aging Studies and in family medicine there. So that's my background, and have always looked at rural health and how we can provide medical education, training, and impact on quality of health. Was on the first quality improvement organization for CMS with Dr. Zimmer out of University of Madison, Wisconsin. So was part of the development team for the first MDS tool utilized in the United States. So kind of always been centered around that quality perspective, but from more of a native aspect. How do I raise animals, plants, kids in a facility? So we had the first intergenerational childcare program at that Eden facility. My son was the first student at 14 months, and we ended up having 90 kids and 90 residents. And we had an NIH study which ended up that you were 62% less likely to go into a hospital in a year's time if you were at one of our facilities. So been blessed with some of those great components, and look forward to seeing how I can add value to U.N.I.T.E, and to Ron Ross, as he's going to be able to help me with some internship as I'm on the American College of Healthcare Administrators executive board, and we're looking at mentorship and administrator and training programs, and Ron has been gracious in sharing that he would help mentor Indigenous students as they want to get into long-term care administration or healthcare. So that's my story.
Thank you. That's interesting about the mentorship, Ron. I don't know, maybe that would be something we could, like, report on, you know what I mean? Like have a little summary paper, or, kind of talk about the progress that's being made on that, because that would be really interesting.
Yeah, and I was just looking, Ron, we can talk about it offline, but I am a grant writer, so I've participated as a PI or co-PI on $72 million worth of grants. So that would be something, is could we look with HRSA to look at the staffing needs and unique cultural components of Indigenous aging facilities. So I think that would be pretty unique, and I can guarantee you HRSA doesn't get many applicants that are putting in for that. So maybe the first phase is a concept paper.
Sounds good, Dr. B. I'd love to work with you on that.
Okay.
I would be interested in working with you on writing that, a concept paper.
Sure. Yeah, that would be great.
And I think someone like Tammy with her, or Ina maybe could be involved with that. Sorry, Tammy, I hate to volunteer you, but I know what you've done in your experience. So it'd be kind of good.
That's
Maybe even
fine.
Joseph. Yeah,
Sure.
maybe Joseph. Yeah. I think that would be a really good project to look at in 2022. So Ron, that aside, are we looking at a strategic planning meeting in January? What are we thinking about that?
Yeah, I was thinking the last time some of us talked about it, I would think maybe towards the end of February might be a good time. It's cold up here in the north, and we're thinking maybe something in the Tucson area.
Okay. Like at the casino, like we did for our one meeting that year?
Yes.
Okay.
They have that Suelo is a nice complex and reasonably priced and good food. And that was excellent where we all met there about 3-4 years ago.
Okay. Is that the Tohono O'odham one? No, not Desert, not Desert Diamonds. You mean the other one, the
Suelo. It's just west of Tucson.
Yeah, I know. That's not the name, but it's Plaza, not Plaza. I want to say Plaza del Sol. It's not Plaza del Sol. It's the Yaqui, right? Tribal, the Yaqui one, the
I
Yaqui
might not be
Casino.
pronouncing it right, but it's like
Yeah,
SEW something.
yeah. I think it's the Yaqui Casino. Yeah. Okay. I think that would be great if people are willing to come out. Why don't we put out a feeler for who would be able to do that? You know,
I would like to ask if it could be perhaps mid-February, or I don't know, maybe, or if we looked at March, it'd have to be more towards the end, because I'm gone that first week and a half of March.
okay.
So it would be impossible for me to be gone, turn around and be gone. So I don't know if there's any any flexibility in that. The one thing, Debbie, we had talked about when we were suggesting this was perhaps a trip out to Archie Hendricks, because we have new members who have not been able to go there.
Yep.
And now that they're a member again, maybe they would be kind enough to let everyone take a tour again. That was really worthwhile.
I visited with Travis, who's the COO, and we worked extensively with Travis, and he was successful in getting Archie Hendricks to be a member last July. And I just visited with Travis here a couple of days ago, and they're interested in being a part of the strategic planning. And so, Tammy, maybe we could make it somewhere around the 10th of February, just to throw out a possible time frame. Would that work?
Yes, that would work much better for me.
Well, then let's think about that.
Either the second or third week of February would be great, but the end of February just is impossible for me.
I just threw out something. So
yeah,
let's get something pinned down. I can talk to the hotel there and see what accommodations, and maybe there's something busier time or not. And I'll start that process.
Okay.
I was going to say, I think Travis could help you probably secure a room or whatever.
Sure.
Yeah. Okay. So the sooner we get that on the schedule, the better, so we can find out who can come. But I think, we're at a point where I think it would be a really good thing to do, and we could have some information back, from our calls that we're making, and work on the value statement. I think that's, that would be really important to do, get that on our website. I think that's a good idea. There's a lot going on. We probably should look at the bylaws too, Ron.
Okay, we can pull them up and bring them to the meeting.
Would our elections be in March again, or could we do them at that strategic planning meeting?
I'd have to look at the bylaws.
Last year that we would do them yearly. So I think that's important. Okay. Anyone else? What time is it? 1:45. Okay, let me double check the agenda, make sure I didn't forget anything. Let's see here. Where's the agenda? Okay, so I think we covered most of the old business. Let's see, let me double check, make sure I didn't forget anything. Hopefully there'll be a TTAG call in January. Joseph's not on the call. Did the financials. So our next membership meeting would be in March, which technically is when we would have our elections. I think we put that into the bylaws, but we'll have to look at that. Let's see. We talked about leading age, KI. Okay, is there any new business? Any new business? Anyone have anything going on that we haven't already discussed that we should be discussing? Okay. All right, well, then it's what, a little bit early, so that's fine. Tammy, I sent you a chat, if you can check that in the chat function. Our next meeting then will be in January. That will be, let's see, the third Thursday, January 20th. And that will be 3 p.m. Eastern. So wherever you are, that's 3 p.m. Eastern on January 20th. And I'll wait to hear back, Yasmin, on the MOU. We'll talk about that. And then we'll look possibly to having our something in February with a strategic planning meeting where we'll review the bylaws and go over. And then, you know, Dr. Bernay, if you want, between now and January 20th, we could go ahead and schedule a call maybe to talk about this mentorship with Native American administrators. I think that's a really great thing we could work on in 2022. So if you want, I can set up a Google Meet between like me, yourself, maybe Joseph, Tammy, Ron. What do you think?
That sounds good.
Okay.
Yeah, and I can, I know you're affiliated with Leading Age, but I could also talk about the American College of Healthcare Administrators. We just added a diversity, and I'm going to be chairing that committee. So that's a big part of our mentorship. And then I'm a national reviewer for the NAB licensure. So with Randy Linder, so I do accreditations of the universities, and I'd like to, and that's where Ron and I started the conversation, was the challenges of American Indian administrators or staff passing those national boards. It's really, we've not had a great success rate. So, and I think it's just, there's some cultural disconnect there that we haven't identified, but I think if we get to where we're working with Ron and he's getting to see what their MOTSI, how good they are, you know, what they're missing, what their strengths are, then we can start changing some of the curriculum requirements in the university setting. So,
Ron,
Ron
was when Tiffany started as the administrator, was she in a program? Wasn't she in some kind of mentorship program, I thought?
Well, yes. Nebraska requires an administrator and training program. Different states call it different things. One of the things that Tiffany had going for her was she had been the business manager at the facility for a couple of years. So she had some long-term care exposure. And then with the education that she had, and then she was fortunate to have an administrator of mine who had worked for me for 20 years, take her under his wing and spend the time with her and to work with her so that she could pass the national board. But not everybody has that talent available to help people.
Right. And we have such excellent, like I'm thinking like Melissa's on the call and Deb Arbogast and Tammy and Tiffany. I mean, like right now we have some administrators who could, you know, really have such a wealth of experience. And I'm sure there's tribes who would like to have a facility like this. But, you know, again, you have to have the leadership, right? So this could be a feeder program into, you know, something to bring people to these new facilities. Jared, where's the Philandro one, Sue? The one that you showed some pictures in our newsletter. Where is that coming? Where is that?
The Philandro Santee Sioux tribe is 50 miles north of Sioux Falls, directly north off of I-29. And the Philandro Santee Sioux tribe is a small tribe, but they are building a nursing home, 32 beds, nursing facility, and then I believe a 12-unit memory care. And as you can see by the pictures that Jared continues to provide, the facility is moving at a fast pace. And I imagine that we'll probably be occupying that building in August or September.
Oh, wow. Okay, good.
We are also in the process of working with the 3 affiliated tribes up in North Dakota. Those folks have just finished building an assisted living facility, and we're right now in conversations with them on, let's say, heavy consulting / management of that facility. And they just got it done. It's just now being finished. And so, and then there's other tribes, you know, that are looking at either nursing homes or assisted living. It's, as Dr. B said, you know, a lot of it's just whether or not they have the capacity to take a risk,
Right.
and how comfortable they are.
Right.
It's not that they don't have needs. It's not that their elders don't have needs. And it's not like they wouldn't like to put them in a different environment than what some of those folks are in right now. So it all takes time.
Yeah. But I think to your point, Deb and Ron, that we've got the talent, maybe as a complete team, to help that aspect. And my expertise is equity and working with HUD and putting together the package to do the development. That's what I do. So that was the beauty for me to meet Ron, is he loves the administration aspect, and so we can really help from all the way design, certificate of need if it's a CON state, to getting that certificate of occupancy, you know, with the tribes, and then now we got to run them. So it's building that capacity so that they can get the staff. If they depend 100% on travelers, that's difficult. It's very expensive, and you've got to get it to where you can manage a bottom line. I mean, even not-for-profits have to make money. So, you know, it's just a good, and with Yasmin, she might know, one of my mentors was Mary Alice Ryan. So we were both young when we started out in this business. So, you know, I was a turnaround specialist for Mary Alice. So whenever there was a facility, maybe faith-based, that was in trouble, that's Mary Alice pulled me in to go in there and turn them around. So it you know, it's easy to get into trouble, unfortunately, in this business, and you need to constantly be at providing good quality care and financially sound, because you don't want it to be a burden onto your tribe to where it's just a drain.
Wow. Ron, do you have the contact information, the address, that type of stuff for that assisted living you mentioned?
Well, it's in partial North Dakota, which is on the reservation. It's just probably 20 miles or so east of Newtown, which is right there on the Missouri River. I've never been there. I've just started talking to those folks a couple of weeks ago. So it's North Dakota is kind of unique for assisted living. They don't pay for a room and board. So you're looking at how to pay for units of service, whether it's bathing or feeding or capturing those units. And then coming up with a price, a rate that they're willing. So it's a little different animal for us, but I mean, it's understandable. I just don't know how you make Medicaid work in assisted living for a situation.
That's very, very difficult. It's like that in Missouri. You basically get a cash grant of $258, and the rest of it is based on ADLs.
Yeah.
You know, when you're getting $9.68 per click, you've got to do a lot of clicks to make it up. So it's very problematic.
The only
That's why a
reason-
lot of, that's why a lot of states have skilled facilities, because there's basically just a void for social service support for assisted living.
I wonder if Alaska is different because we have quite a few on our CMS directory of assisted livings in Alaska. Is it different? I guess. I don't know.
My best guess is it's totally different, and the money that they can put towards a few people that they have in facilities. I mean, think of the money they have.
Right, yeah. Very wealthy from a native perspective, yeah.
Okay, and part of the reason I asked was to get that, how we have that directory that we update. So as we learn about homes, we want to make sure that we get KAI to add them. I just want to keep that directory as current as possible, so.
Sure, no, that makes sense. Well, it's just coming online as we speak, so it's brand new.
All right, okay, well, that's really good. Thank you all for being here and for sharing, and we'll set up a meeting, Dr. Bernay, between now and the 20th. So, all right, thank you all. Bye-bye. Merry Christmas.
Thanks, Debbie. Merry Christmas.
All righty, bye-bye.
Thank you.
Merry Christmas.
Merry Christmas. Thank you.